Hi, my name is Christine Delisle. I'm an FNP student at United States University. I'm here to discuss a patient that was seen in the clinic this past week. We'll call her AB. Date of birth is 6/1/1948. She is 76 years old. Her insurance is Medicare. She is a Caucasian female. She presents to the clinic with complaint of increased shortness of breath with activity and swelling in her feet. She is independent. She presents unaccompanied. She lives with her husband. She is a good historian. She is alert and oriented ×3. The increase in shortness of breath has started approximately 1 week ago. She noted becoming more short of breath going up and down her basement stairs to do the laundry. Resting more and doing less activities have helped with the shortness of breath. She also has noted that increased activities, walking in the grocery store, has increased the shortness of breath. The swelling in her feet also started at approximately the same time. She's noticed that it does improve if she elevates them at bedtime and wears the elastic stockings during the day. She also notes becoming increasingly more fatigued in the afternoon, and this is improved with rest. Her diet remains a healthy diabetic diet with low sodium, low fat. She denies increasing her salt intake or changing her diet in any way. She is a non-smoker, non-drinker. She did walk the length of her street prior to the increased shortness of breath. Her past medical history includes congestive heart failure, chronic kidney disease stage 4, diabetes type 2, and arthritis, especially in her knees and hips. On examination, the patient is seen with increased work of breathing. Respirations are 22. Lung sounds, she has some scattered crackles throughout. Heart is regular rate and rhythm. She has a benign abdominal assessment. Bilateral lower extremities, especially the feet and ankles, are 1+ pitting edema. Blood pressure is 138/82. Heart rate is 110. Respiratory rate is 22. Her pulse ox is 96% on room air. Her current weight is 192 pounds, which is an increase in 10 pounds over her physical weight 3 weeks ago when she had her physical. My differential diagnoses for this patient are anemia. Anemia can cause increased shortness of breath due to a decrease in red blood cells to carry oxygen to the organs and the brain. My second differential diagnosis would be atrial fibrillation, which is a rapid, irregular heartbeat that can cause poor blood flow, which decreases the oxygen to the cells. The patient's heart rate was regular and 110 beats per minute. Though this is a little bit elevated, the patient is also admittedly anxious. The third differential diagnosis I chose was asthma, which causes inflammation and narrowing of the airways in the lungs, causing wheezing and decreased air movement. The patient has no history of asthma, so this is ruled out. The most likely diagnosis for this patient is an exacerbation of her congestive heart failure. My plan would be to increase the patient's diuretic, perform some lab testing, an x-ray, possibly a cardiology consult. The patient was provided with diet education and encouraged to continue a low sodium diet. The patient was also encouraged to exercise as able and to follow up in 2 weeks.